Awesome. All right. Hang on. Success. Liftoff. Bringing my non-echoey mic over here. All right. So hello, everyone out there in social media land, I like to say, whether you're watching us live or whether you're watching a replay. Welcome. I hope everyone's doing well. As always, I like to connect local professionals and business owners and people out in the community with other folks in the spirit, Tonya, of kind of networking, even though we're in unusual times. So I am honored to have as a guest today Dr. Tonya Curtis, and Tanya is going to talk with us here in just a second about her clinic, her center, and what she does. But how are you doing today, Tonya?
Hi, good to see you, Toby. We're hanging in there, doing what everybody else is doing, and trying to adapt and connect in different ways.
Yep. So the name, we were just chatting a few minutes ago beforehand, and the official name, the name of your medical center, health center for animals, is the Palmetto Animal Health Center. Is that correct?
Yes. Yeah, we're here in Mt Dora.
I was going to say, where are you at, and what does that mean? So you're a doctor of veterinary medicine out in Mt Dora. So are you guys considered an essential business through all of this?
Right now we are, and it's kind of, we have an advocate of a national syndicate that helps us with guidelines on what that means and how we operate. And so under those guidelines, we get to continue to service and see our patients.
Awesome. That's important. So everyone out there, and I know I have a lot of followers and a lot of connections that are huge animal lovers, that they have their own furry families. They love their pets, their dogs and their cats. And I have a lot of friends that are like I am. Their pets are their world. And Tonya is one of those vets, guys, that you're really going to want to connect with. And in a few minutes here, we'll give you the opportunity for her to share, what's the best way to reach her health center and to connect with her on social media. But Dr. Tonya has been recommended to me by many people, and I live in Central Florida, some of you know. And she mentioned her center is up in Mt Dora, which is just a little hop, skip, and a jump from where I live. But I don't take it lightly when someone goes out of their way to recommend their vet, because, like I said, we care so much about our furry family members. And so I wanted to make sure that we gave Tonya the exposure to all of you and the opportunity for her to kind of share a little bit about Palmetto Animal Health Center. Now, Tonya, do you have a certain way that you run your practice? I think you mentioned you kind of like to look at all different avenues and really customize a treatment plan and a plan for your patients, for the animals. Is that fair to say? Is that a good way to say it?
Yes, we have two associates, and we always put our heads together. I like to really think outside the box and also look at what the personal needs are, what your personal beliefs are. I mean, medicine is also a belief system, and it's also a practice. Yeah. So that's the lucky part that I get, is that I can use my brain, what I've got in there. Yeah. I use that to relate to you, to meet you, see what we are going to do to get quality of life, longevity of life. Our thing is better, longer, stronger. And, medicine, that's our deal. And I say it all the time. That's just how we.
Yeah, it's not a one size fits all. It's not like, here's how we do it here, which we've all been to those type of, at least I have in my history, I've been to those kind of veterinary centers where they're like, this is how we do it, take it or leave it, right? One size fits all. It sounds like you're the complete opposite. To your point, you want to do what's best for that particular animal.
That's true. That's absolutely true. Within our walls, we're going to look down all these different avenues, and sometimes there's more is more, and sometimes less is more. Just depends on what the creature needs.
Yeah.
Quality, always quality. We always want quality. We want quantity, but we want quality.
Yeah, no, it's music to my ears, and I'm sure many people that are listening.
Yeah.
Anything that's because of this whole COVID-19, is there anything you could share really quick that's kind of something that maybe people like myself, pet owners, should just be cognizant of or kind of think about going through all this unusual time? Is there anything that, you've been seeing or thinking a lot about differently?
Probably a couple of things too. One, I was talking with a colleague and we were kind of joking, but thinking about, she's at home with her dogs. I'm out of the office a couple days. I've got my dogs, and she's like, imagine all the separation anxiety that's going to happen after the patients have been home for a month, or 3 months. You've been at home and they're used to you giving attention, and then you go back to work, or things change, or the kids go back to school. It's kind of like the dogs are on vacation, and then their vacation's going to end and you're going to go away.
Yeah, it's a
So
really good point, because they don't have
yeah,
that structure anymore, or that consistent, yeah, everything, all the
yeah,
patterns have changed, right?
yeah. So there might be some adjustments, and just be cognitive and aware that, if they chew up a pillow when you go back to work, there's probably a reason.
Yeah.
Um,
I was
also
gonna,
just,
yeah, I was gonna say, how would that manifest itself? It could be in like you said, chewing or behavior type of
yeah.
thing. Could there be anything physical from that? Of course, they'd want to check with you particularly to see. But I mean, could there actual be like eating habits change? Something that looks more, even potentially more serious, like it would be something that they were sick, for instance. Like, you know what I mean? Does that make sense? Nothing like playing
Absolutely.
toys differently. How else could that show up?
Cats, behavior changes and urinary tract infections. So in cats, dogs, stress diarrhea.
Yeah.
Nobody wants to come home to a pile of that, and that can definitely happen.
Yep.
Not eating for a couple of days, which is, if it's not their normal, certainly needs to be brought to our attention.
Sure.
So, yeah. Oh, yeah. And then the regular destructive behaviors, which are the,
Yeah.
chewing of, or, even self-injury sometimes, self-chewing or anxiety, licking and things like that.
Yeah, acting out. Interesting.
Yeah.
So I cut you off. You were going to say something else. So yeah, I think that's really, when you shared that, what was the number you said? Was it it was like 50% of things that you deal with are usually, you mentioned that again, I don't want to mess it up, something to do with
No.
behavior?
Yeah, there's behavior abnormalities stem in our society now because of how we operate, and we're so busy. Our creatures take on a lot of that, so we see a lot of anxieties and behaviors, and some medical things that occur because of that. So
Wow.
it's a big part of what we do. There's people that just do behavior,
Yeah.
but
Yeah.
so
Yeah, they
yeah.
pick up on it, right? I was out at
Hmm.
a friend of ours' farm this weekend, and we
Hmm.
were talking about that, and they said how when one, and it's like even as humans, right? Because we're animals as well. They were talking about how one cow out in the field, when one cow gets spooked, even if the other cows are a ways away, they all start that energy kind of, you could see it go throughout the herd, that all of the cows start getting anxious and start acting out. So
Yeah.
yeah, it's contagious, so to speak. It spreads that feeling, that anxiety.
Yes, it does.
There was something
It,
else you were going to mention, and I rudely cut you off. Sorry.
no. Maybe just how things have changed, and how, veterinarians, we're lucky to practice at all. We're in a great country that allows us to treat our pets the way we do. So that's a gift. But the way veterinarians that I grew up with certainly were very, most of our enjoyment comes from healing and our relationship that we have with you, and the ones that we create with them, the patients with pets. And so all those are encompassed together. And so we've been lucky to be able to talk to you and spend lots of time and be there. And now we're kind of separated from you guys like everybody else. So we're doing drop off service, and we're doing more telemedicine. And so the the rules of how we practice are changing, and they're under a huge umbrella. So we still have to abide by, the laws of dispensing and regulations. And I mean, veterinarians are held to a very high standard for that. So I guess just being aware that we're not abandoning that idea of that relationship. It's just that we're really treading lightly on how do we see you? How do we make sure that we've satisfied, what we're supposed to do? And
Yeah.
those are all the cool stuff about it, but it puts another stress on my team, on me, on, because they're like, well, how come we can't do this way? And it's like, oh, we're in the waters just like everybody else. So everyone's been great though. I don't have any complaints. Our patrons and our kids have been fantastic. Just it's been kind of bringing together. So I'm glad.
We're all trying to navigate these these unusual, uncharted waters, right? So that's a great point though. I catch myself, I think I consider myself a fairly laid back, just kind of person naturally. And even myself, I've noticed that I'm a little on edge, or to your point, if something doesn't work like I want it to work. I went to the grocery store a couple weeks ago, and I was at the checkout, and they wouldn't let me take more than 2 waters, like individual waters. And I thought it just meant bulk water, that you couldn't take 2, 24 packs of water, but I couldn't buy more than 2 actual, half-liter little bottles of water. I don't think that's what the rule meant, but whatever. But anyways, normally I would say, oh, no big deal. And it actually I caught myself kind of getting a little like
what?
I want to push back on this, but but to your point, everybody's just in this together. So we have to be patient, comes to mind, patience and being understanding. And that goes back to what you said, though. It's why it's so important to have such a great relationship with your veterinary doctor, because then you understand each other. You have a relationship, right? You have a connection there.
Exactly.
So, so if someone is right now in between veterinary health centers, or they're not happy, I dare say, with like I was years ago when I was in Georgia, I was not happy with my vet. It was kind of just a necessary evil where I lived. And long story short, I felt like I didn't have enough, as many options. I encourage everyone to connect with Dr. Tonya Curtis, follow her online so you can stay connected, because it might be now that you are looking for a new vet, or it might be in the future. So make sure that these kind of times and opportunities that we get to speak directly with you is really an honor. And thank you on behalf of, like I said, of all the pet parents out there for working as hard as you do, especially in these unusual times, to take good care of our fur babies.
Well, we appreciate you guys, that you are the lifeblood of what gives us joy and also gives us our jobs. And so it's a huge veterinary family. I believe you should love your veterinarian. I don't, I never, if you are happy somewhere, I would never encourage you to change. Because that's a great relationship, and you should mentor that and keep that.
Like I said, if you're not, there's an opportunity to have that, right? Yeah. 2 quick questions, and I'll let you back to it, because I know you're busy. One, so what kind of pets do you have, or do you have pets yourself?
Oh yeah, I have 5 cats.
Oh my gosh.
And 2 dogs. I have a 3-legged 10-year-old Jack Russell Terrier named Lucy, who, she had a terrible accident, and their parents didn't want her, and so she found her good home with me. Well, I think I got a good home. And then I have Ruby, who is from one of our rescue organizations that I adopted 2 years ago. She's a little Chihuahua Jack Russell, so they have got my hands full with them. So
I bet. Are there any organizations? I know you probably have multiples, and people that you work with and organizations that you work with. Anybody you want to give a shout out to that in particular, that I don't know right now that they might need help, or that you want to on social media kind of give a shout out to? I'll make sure to.
Absolutely. Rebecca Lynch with Poodle and Pooch. Okay. She does a magnificent job, and that's where Ruby, my little one, came from. She works with East Orlando and with us, and she's a Central Florida realtor, and she is amazing. So they do a lot of good work, but they do need fosters. I think they foster all their creatures. So
got it. Okay. Well, we'll make sure to connect with them, which leads me to my last question, which is, what about you? Do you have social media pages that you like people to like and follow?
We do. We try to be very informative. We have a very informative website. You can see that. We also are on Facebook and we're on Instagram. So we have those as well.
Awesome. How do you like social media yourself? Are you personally, I mean, do you do a lot of social media, or is it kind of a something necessary evil in business side, or do you like to play around with it?
I'm not I have a bunch of wonderfully talented people around me that love it, are good at it, so I let them do that.
Yeah, it can be a rabbit hole of sorts too. It's
Yeah. It's great. It's just it's not my direct forte.
Oh, I get it. Believe me, years ago I was in the banking business for my first career, if you will, and didn't even have a Facebook account up until a couple of years ago. Now I'm sucked into the vortex of social media.
And you're good at it, so there you
go.
go.
World, it's a whole world. But well, listen, thank you again very, very much for your time. And look, I hope everyone connects with you, and I encourage everyone to stay in touch. And I hope that you and your family stay well through all this unusual time.
You as well. You as well. And it's just unprecedented times. So we're here. Even if you have a question, if you have anything, you can air vet us. We have telemedicine, and you can call us. And if you just need information, we're always happy to get that to you.
Thank you for that offer. And I'll make sure to below this video and all the different places, I'll make sure to put a link, and I'll get with you and get the phone number that you want to put, and we'll put that right easy for everybody to find. So,
all right.
All right. Thank you so much. Have a good rest of your day. Take care.
You too.
Right. Thanks. Bye-bye.